Hello, my name is Carol Wysham. I'm a clinical endocrinologist practicing in the state of Washington and the current president of Endocrine Society. I appreciate the opportunity for taking a few minutes to talk about one of the important milestones in the treatment of patients with diabetes. 100 years ago, two Canadian researchers discovered insulin. They sold the patent for $1 so that they could ensure that anyone who needed insulin could have access to it. Having had the availability of insulin took what was a slow, painful death for many with type 1 diabetes to allow them to live a healthier, longer life. Having access to insulin for patients in my practice is life-saving. A large proportion of the patients in my practice have type 1 diabetes. They couldn't live more than 2 days without access to insulin. And for my patients with longstanding type 2 diabetes, it has allowed them to control their blood sugars and allowed them to have normal life expectancies without diabetes complications. And I'm proud to say I have patients who are in their 80s and even 90s, and two made it to 100 with diabetes thanks to the availability of insulin. Despite the incredible advances that have occurred with the treatment of patients with diabetes, the prevention of diabetes, and the research that's happened, there's still a lot to be done. Of course, top on the list in my mind is the availability of insulin. We need to continue to work towards affordable insulin for everyone who needs it. But I'm also looking forward to the day that we can prevent diabetes from happening. And for those patients who already have diabetes, a cure for diabetes would be great. But in the meantime, there's a lot of work that needs to be done in health equity. We need to be able to assure that everyone has access not only to the insulin, but also to the newer life-saving diabetes medications and to the technology that allows people to control their diabetes to near normal glucose levels. I want to thank you and all of the members in the congressional offices for the work that they've done with the Endocrine Society to assure the affordability of insulin, to work on increasing diabetes research, as well as support of the diabetes prevention programs. We look forward to continuing to work with you on these important initiatives. Thanks again.